Hello friends, I am a student at the Universidad Católica Santiago de Guayaquil. My name is José Antonio Barragán and my topic is evaluation and care of patients with the diabetic retinopathy and my three social networks. Definition: Diabetic retinopathy appears as the result of damage to the blood vessels of the tissue located in the back of the eye. Blood sugar not properly controlled is a risk factor.
Diabetic eye disease refers to a group of eye problems that can occur as a result of diabetes. Without diagnosis and treatment, diabetic eye disease can cause severe vision loss or even blindness. Diabetic retinopathy is the most common diabetic eye disease and is a leading cause of blindness in persons with diabetes. It is caused by changes in the blood vessels of the retina. The retina is the light-sensitive tissue at the back of the eye. A healthy retina is necessary for good vision. In some people with diabetic retinopathy, blood vessels of the retina may swell and leak fluid or blood. In other people with diabetes, abnormal new blood vessels grow on the surface of the retina. At first, diabetic retinopathy may not cause any changes in vision, but over time, diabetic retinopathy can get worse. At first, a person might see spots floating in their vision, or may notice a general blurring of vision. Eventually, diabetic retinopathy may cause vision loss and even blindness.
Application in medicine. Treatment is based on what the ophthalmologist sees during the examination of the patient eye. This may include glycemic control. Sometimes that improving metabolic control can improve vision. Physical activity is another pillar of diabetes treatment. Special type 2, at the least 100 minutes of physical activity per week must be the practice. Corticosteroids, they block the eye inflammation that accompanies diabetic macular edema. They are solid drugs and can last several months inside the eye, therefore not as many injections as necessary.
One of the biggest hurdles we have in our healthcare system is making sure patients get timely exams to screen them for disease. And if they have disease, to make sure they're seen by an eye care specialist who's well versed in managing diabetic eye disease. In this country, that's typically retinologists who do this on a routine basis. Multiple studies have shown patients do not get timely screening exams. 50% of them, based on most studies, do not get adequate screening exams by eye care specialists in this country. So there's a tremendous need to make sure they get screened. Primary care doctors are aware of it, but for whatever reason, the system is letting a lot of patients fall through the cracks. Consequently, I think we need to come up with new processes to get these patients screened. And I think something that can be done that I think will increase based on our experience and on studies that have been published is this idea of telemedicine, of screening in the primary care doctor's office with cameras allowing the capture of the image, a retinal image that's then read by a retinologist to determine if this patient needs to be seen by the retinologist in order to manage their diabetic eye disease if they have it. I think some of the barriers of patients getting the recommended screening exams is just the increased cost of seeing another doctor, or someone else they have to see when they don't perceive any problem with their vision. So why are they going to go waste their time, miss another day of work, pay another copay? All these are barriers to screening. That's probably the biggest one, in my opinion.
One strategy that has great potential is teleretinal imaging. What happens is a patient will have their image of their retina taken with a non-mydriatic fundus camera at a primary care physician's office. This is often done at the lab where they're already getting blood work done, and they can simply have a picture taken of the back of their eye. This image is then uploaded to a cloud-based platform where a trained reader will interpret the image. This trained reader may be an ophthalmologist or retina specialist. A report is then generated and sent back to the primary care physician as well as the patient. And when there's coordinated care, these patients may be referred directly to an eye specialist. What this does is that it eliminates several of the barriers, including lack of transportation, lack of time, as well as lack of cooperation. It can also reduce costs for the patient. There's no longer a need to make another doctor's appointment. They don't have to take another day off of work. And it also helps the caregiver and family members that need to bring them to doctor's appointments. Likewise, it can reduce costs to the healthcare system. A simple image is going to be less costly than having to cover the cost of another doctor's appointment. Furthermore, it can help the ophthalmologist practice patient flow move smoother. If you can eliminate the 50% no-show rate for patients who don't show up for their diabetic eye screening, it can be very helpful. One of the benefits of teleretinal imaging is that it can also identify patients who truly have diabetic retinopathy and sight vision-threatening disease. And think of it this way. If you're a patient who has diabetic retinopathy and something that can affect their vision, and you're told that you need to see a retina specialist or an eye doctor promptly, would you want to make that appointment? I suspect yes. Deep learning algorithms are showing a lot of promise in detecting pathology in retinas, and thus far have been shown to be beneficial in detecting macular degeneration and glaucoma. For diabetic retinopathy, it's almost there. One of the most important things is to improve the sensitivity of these diagnostic tests and algorithms in order to aid physicians in detecting these vision problems. There's one home monitoring system that's already FDA approved to detect subtle changes in patients' vision in the field of age-related macular degeneration. Anything that can help a patient detect something while they're not being seen at a physician's office can be helpful. Again, early detection and prompt treatment can save vision. Some payer organizations are recognizing the benefit of teleretinal imaging and home monitoring systems. Many studies show that early detection of disease can lead to prompt treatment, and these can be vision-saving. A lot of these organizations are also recognizing that short-term investment in these can lead to long-term savings down the road. Hopefully, more commercial insurers will come on board.
Pros and cons. A weight loss diet, exercise, stress management, and maintaining contact with other diabetes patients will improve not only your diabetes control but also your overall health. You will adopt healthy habits that will make you healthier. Traditional retinal detachment involves working of the central retina by pulling membranes and filaments, causing visual loss and vision and twisted lines.
With nonproliferative diabetic retinopathy, or NPDR, damaged blood vessels in the retina begin to leak fluids, including small amounts of blood, into the retina. Sometimes deposits of fats may leak inside the retina. These deposits are called hard exudates.
Issue applied in Ecuador. In Ecuador, there are many people complicated with diabetes mellitus, of which 45% progress to diabetes retinopathy. The strategy is to raise awareness among the population so that they have control and improve their diet.
One form of diabetic retinopathy is called non-proliferative diabetic retinopathy, or NPDR. NPDR occurs when diabetes damages small blood vessels within the retina. These vessels start to leak both fluid and blood, gradually causing the retina to thicken or swell. Over time, the swelling, or edema, thickens the retina, causing the vision to become blurred. One form of diabetic retinopathy is called proliferative diabetic retinopathy, or PDR. PDR occurs when new and fragile blood vessels grow abnormally from the retina into the vitreous. This can result in bleeding, scarring, and contraction of the vitreous, which may lead to retinal detachment. PDR can cause severe vision problems, and it can even lead to blindness. It must be treated as soon as possible. Macular edema is a condition that occurs when fluids build up within the macula, the central area of the retina most critical for vision. The buildup of fluid causes the macula to swell, disrupting its normal shape. This results in damage to vision. The symptoms of macular edema include blurred vision, distortion of images, missing areas, or a change of contrast in vision. Left untreated, the swelling can cause these vision problems to progressively worsen. If any of these vision problems occur, speak with an eye care professional immediately.
Conclusion. Diabetic retinopathy is a leading case of both moderate and severe vision loss worldwide. Over the past decade, advances in technology have dramatically improved the evaluation, treatment, and visual outcomes of patients with diabetic retinopathy. Current approaches are reviewed.
Diabetic retinopathy occurs when the blood vessels to the retina become blocked. The retina sits in the back of the eye and is where our vision begins. Our body tries to supply blood to any organ any way possible. So it tries to find new ways to do this when a vessel becomes blocked, which can lead to blindness or detachment of the retina. Is one of the leading causes of blindness in the United States, but it is the leading cause of blindness in people who are aged 25 to 60. We know that over 60% of our diabetics will have an eventual diagnosis of diabetic retinopathy. Diabetes and uncontrolled blood sugars affect the vasculature all over our bodies and cause significant damage. Our smallest vessels are at the highest risk for this damage, which is especially true for the vessels in the back of the eye. This disease is not a catastrophic event, it is progressive. The longer a patient has uncontrolled blood sugars, the higher their risk is for diabetic retinopathy. Our patients with diabetes are recommended to get checked yearly with a comprehensive diabetic eye exam. Diabetics are also at higher risk for other diseases that affect the eye, such as glaucoma and cataracts. Some of our primary care offices here at Christiana Care offer retinal screenings in the office. These are effective tools to screen for diabetic retinopathy, but should not replace the comprehensive eye exam because these retinal cameras do not screen for any of the other diseases. The first and probably most important is developing a healthy lifestyle, which includes eating well and exercising on a regular basis. The other modality that we use to help our patients control their blood sugars is with the use of medication. So we usually recommend our diabetic patients see their primary care physician at least twice a year. As a family physician, I think it's very important to get that one-on-one contact with my patients to make sure that they're staying on track with lifestyle changes, they're taking their medications appropriately, or there's not something else that's going on that could be contributing to their diabetes not being under control. It also allows me to talk about any social issues that might be impacting their disease, and even give them the option of meeting with our behavioral health consultant to identify behaviors that might be impacting their diabetes.
Thank you very much.